Hi everyone, I'm Phaedra Kress, your moderator for ASJ GEMS. I'm here with Dr. Bertha Torres, who will be performing rhinoplasty after filler injections, when to say yes. Great topic. Dr. Bertha Torres Gomez is originally from Mexico City. She's a plastic surgeon certified by the Mexican Council of Plastic, Aesthetic, and Reconstructive Surgery. She graduated in 1996 with honors from the Faculty of Medicine at the National Autonomous University of Mexico, UNAM. She completed her postgraduate training in plastic, aesthetic, and reconstructive surgery at the Hospital General de Mexico and pursued a postgraduate degree in medical sciences at UNAM. With over 20 years of experience, she currently practices privately at the Hospital Español. She was the first, and this makes me so proud to say, the first female president of the Mexican Association of Plastic and Aesthetic and Reconstructive Surgery, one of our global alliance partners, AMCPER, and is on the ISAP's board of directors as chairman of national secretaries and national secretary for Mexico. She has 15 publications in indexed national and international journals and 2 book chapters. She has participated in numerous courses and conferences in Mexico and has been a professor in over 60 countries worldwide and over 5 continents. She was honored with the Brody Lecture in 2024 at the California Society of Plastic Surgeons and the keynote lecture in the ISAP's master course in St. Louis, Missouri in 2026. Welcome, my dear friend.
Yeah, I'm very happy for the invitation. It's an honor and a privilege to be here. I'm very excited to share probably a very interesting topic for some surgeons. At the end, we have to face some new challenge, especially in nose job when we have a previous filler injections. So I'm very happy to be here. Thank you so much for the invitation. And if you want it, we can start at the moment that you say.
Sounds great.
Well, good morning, everybody. Hello for the people who is connected. I'm going to talk about what we have to do when we have to perform rhinoplasty in a patient who previously had rhinomodeling. As Phaedra mentioned, I'm from Mexico, and I have this lecture because I want to share with you some specific advices regarding this. Of course, I don't want to miss the opportunity to invite everybody for the next month on May 14 to 17 in Boston. It's going to be a great meeting with great friends and amazing faculty. So hope to have the opportunity to see you all there. I have no disclosures for this presentation. And as you know, by far, for the past 10 years, rhinomodeling has increased a lot. It's probably one of the aesthetic procedures the fastest growing in the worldwide, because it's performed not only for plastic surgeons, dermatologists, or aesthetic physicians. So, as a plastic surgeons, we know that we have options to improve the aesthetic appearance of the nose. We have not surgical rhinomodeling or surgical procedures. But let me focus something. The rhinomodeling probably has a better compliance for the patients because apparently it's more simple, it's minimal invasive, it's a less cost procedure and with a fast recovery. But the indications are only for a mild deformities of the nose. And we can correct only small contour irregularities following surgical rhinoplasty or previously. But it's not a totally safe procedure. We must take this in consideration. For us, as a plastic surgeons, our gold standard is the treatment of not only the aesthetic part, as well as the functional part in the problems of the nose. And we must have, of course, experience and develop surgical skills in rhinoplasty. The main objective of this topic is to try to provide information on what we have to do if a patient with previous rhinomodeling wants to perform a rhinoplasty, because sometimes we don't know what to do and there is not too many information regarding this. Unfortunately, until we have a problem, we have to discover what to do. But we must be aware with these kind of patients. And the problem is to try to answer the first question: how safe is to perform a nose surgery after rhinomodeling with fillers? And as far as we know, according to the current data, at least 2 or 3 times before surgery, a patient injects a filler. Is the average number of injections that he used to do before to try to correct definitely the nose with a rhinoplasty. And the number of patients that are going to seek for a rhinoplasty after rhinomodeling is going to increase in the future. So it's going to be a problem that we are going to have to know how to manage with more often regularity. And the first question is when we can to perform a rhinoplasty after filler injections with safety. And we did a review in the data, in the current data, and we don't have too many articles, probably level 4 to 5. But one of the most important was wrote by Dr. Wolfgang Rubich from Germany. And in fact, it's a panel of experts that answer a survey, and most of the experts answer if they dare to perform this kind of surgery with previous fillers or not. And the average is almost the same. 26% say I can do it, and 26% say I wouldn't dare to do a surgery after fillers. So non-publication nowadays can answer these questions in a better way, but probably the most important result or conclusion of this specific article is that we have to wait at least 1 year after rhinomodeling in order to perform a rhinoplasty with more safety margin. And the second question is, after nose surgery, after a rhinoplasty, how safe is to use fillers? And here we have a lot of data. It's very important to take care about this, because when we apply a filler after a rhinoplasty, the risk increase a lot. There are too many articles that are talking about this, and we must be very careful, because the anatomy of the nose after a rhinoplasty is going to be compromised by the surgery. So those retouches with the fillers after surgery could be dangerous, even in expert hands, and we must be aware of this. Of course, we know the vascular anatomy, and we have to try to avoid the risk with the fillers and surgery as well. And even when the literature said that the problems with vascular problems regarding the use of fillers, recovery at least 86% in 14 days with a minimum sequela, and they look like this, there are a minimum amount of patients that can have a very bad or very worse complications regarding to injection of fillers in the arterial vessels. And of course, to try to fix this kind of problems will be a challenge, and probably only a very expert surgeons, I can mention Dr. Frederick Menick, for example, can achieve this kind of results after a tragedy when we have a loss of skin or a very amount with very bad results after filler injections. So what is this for? It's about inadequate training? Probably not. Is excess of trust? Probably yes. But the most important thing is that even with experienced hands, we can have an accident. And this is due because the amount of fillers that we need to block a vessel require a minimal amount of the filler. It's not regarding the pressure that we apply when we do the fillers injection. And don't forget this image in your mind when we do superficial applications of the fillers, how many vessels we can have that will be problematic or can be blocked, unfortunately, during the filler injections. So, talking more about now what to do if a patient after rhinomodeling is looking for a rhinoplasty, we have to do some things before the surgery. The first, especially for the younger surgeons, is to have the conscience that these patients are potentially problematic. The most important decision is to be honest with us if we have enough skills and experience, or is better to refer or say no to this kind of patients. If we say yes, and we feel comfortable with these patients with enough skills and everything, we have to pay attention in the medical record. It's crucial to ask the patient if they have fillers before the surgery, because sometimes they don't believe that it's important information that they have to provide. And if they say yes, we have to try to figure out what kind of filler was used, how many times was applied, in which areas, and when was the last injection of this filler. It helps a lot to have previous photographs that revealing the shape of the nose before the rhinomodeling in order to try to figure out where the filler is. And the informed consent, most aware about the possible high risk of vascular complication after the filler injection before the surgery, because as I mentioned before, this is not a matter of experience. It can happen problematic complication even in skilled hands. So the clinical evaluation is very, very important. We have to evaluate the expectation of the result for the patients. This has an emotional part because patients who are looking for a rhinoplasty after a rhinomodeling probably would like to have a beautiful nose, and the sweating of the tissues, the thickness of the skin or something probably is not the expectative that they have, but they are looking by far for the better results that they have with the fillers. And we have to do a specific evaluation. Transilluminescence probably is not the most useful because it's very subjective. We cannot see everything. But there are some articles that help to take the decision with complementary diagnostic studies could be helpful in this kind of patients. We must be sure specifically in which plane is the material that was injected. And there is a recommendation to use an ultrasound, and a specific ultrasound, to try to figure out where is the filler. But sometimes the people is not very familiar with this kind of studies, and probably will be easier to ask for a CT scan looking specifically for the material of the filler. As you can see in this image, where exactly is the filler in the tip of the nose, and which areas are obstructed with these fillers. So before the surgery, it's very important to try to figure out what type of filler was used, because the behavior, as we know, is different between biodegradable fillers like hyaluronic acid compared with the permanent fillers. And with a review of the literature, there are nice studies with so many cases that probably summarize that for the dorsum of the nose, most of the fillers can be permanent. That an example is the hydroxyapatite, but in the tip, fortunately, more of them are biodegradable fillers like hyaluronic acid. So the advantage of the hyaluronic acid is that it can be dissolved with the hyaluronidase or can be dissolved spontaneously. But something that catch our attention is that this filler is dissolved at least in 3 or 4 or more years, not always in the timing that some companies used to tell us that after 8 months and 1 year the filler was dissolved, because specifically in the nose the fillers last for a longer period of times. And the permanent fillers, we will have a permanent inflammatory problems. This is very well known as the ASJ syndrome, with a permanent substance that in a chronic way produce inflammatory response. And we cannot manage this or solve this permanently. And the patient, even after surgery, could have an inflammatory event. So this is probably the most controversial part of the study about these patients. When we have a hyaluronic acid filler, the question is if we have to remove this filler before the surgery or it's not necessary. And we have different very good articles about this. There is a group of surgeons that recommend to use hyaluronidase before surgery at least 2 weeks or 4 weeks before to perform the rhinoplasty. But there is another group that say that to have the hyaluronic acid really doesn't represent any obstacle to perform a surgery, a rhinoplasty, and it's not necessary to remove it. But pay attention about the third group that mentioned that if you use the hyaluronidase before surgery, you can have problems because the hyaluronidase will reduce the skin, can affect the cover of the nose and can thinner this skin, and probably will be a problem with the rhinoplasty. So we don't have a correct answer in which of these three groups has the more evidence data to take this decision. That we know that it's important thing is to try to figure out where the filler is. This is the clue to have a good prognostic of bad behavior, because if the filler was applied in the correct way, very deep, very close to the periosteum or the perichondrium, probably you can see the filler and remove it. But unfortunately, the filler was applied in the very superficial layers, in the subcutaneous layers. You're going to have by far more risk to have a vascular problems after the rhinoplasty. So, taking in consideration this, if the filler is in the correct layer, of course, you have to perform an open rhinoplasty, because if you are trying to do it in a close approach, it's going to be almost impossible to see the filler. But if you do it with an open approach, probably you can see the filler, you can remove the filler, and you're going to find the anatomy in a very natural way after remove the fillers, as you can see in this picture. But something that is important to mention is that always you're going to have the potential risk of infection for the biofilm that produce the filler in the nose. So probably even with the results can look good, you will have a potential risk of infection, and it's very important to handle this with proper antibiotics and treatments and a very close follow of these patients. But what happens when the filler is in the incorrect layer? And we can have a very, very bad results. And I have this patient, and I have to confess that he was the one who taught me a lot about to try to research more about this field, because after 20 years in practice, so many rhinoplasty good results, and even good results with patients with removing hyaluronic acid fillers before, excessive trust. I have this patient. This patient has hyaluronic injections. He didn't know it because they tried to fix a bad result in a rhinoplasty. And when I opened the nose with conventional procedures, I saw this was plenty of fillers in the nose. And of course, I removed it. I put a very strong structures in cartilage to try to raise the tip. And look what happened. In the second day of the surgery, I have a problem with the vascularity of the skin of the nose. And was really a tragedy, because not only the scars, the skin, the potential risks of infection, the loss of the cartilage that I put as a grafts. Look, the evolution was really, really frightening to try to fix this. And you have to generate a very close, confidential relation with the patient in order to maintain the calm and try to follow him. And the things that I started doing when the scars finally close and everything looks horrible, I start doing applications of fat, like lipofilling procedures with grafts of the auricular conchal cartilage. Of course, I don't have the skills of Professor Manic or something like that to do a better job. But finally, after 1 year, I have a final result like this. And believe me, it's not a good result, even if we resolve the complication that he has. So, what is the most important conclusion of these patients? We cannot open these noses like a conventional rhinoplasty. These patients need some more conservative procedures in the surgical field. I broke all the rules in this patient that I presented because I didn't know that he had fillers in the nose. But if you already have it, and if you don't know that you have filler, you have to keep with a less traumatic approach, even with the open rhinoplasty. You have to avoid excessive dissection to try to avoid the vascularization. You have to try to avoid the excessive closure tension, and you have to try to avoid a very tight spleen pressure. And in conclusion, rhinomodeling with fillers never are going to replace a rhinoplasty. It's a complementary technique, at least in my point of view. The use of fillers in the nose are not exempt of complication, neither in experienced hands. The number of patients waiting for a rhinoplasty after the use of fillers will increase a lot in the future. We must be aware to inject fillers after surgery, especially the patients are ours, because the problem that we can have with the vascular complications increase a lot. And the most important thing is to wait at least 1 year if you are going to perform a rhinoplasty after the rhinomodeling. And be very careful with the evaluation. Use complementary studies if you can't, especially the CT scan. I know that it's an expensive study, but could be your salvation, to see where the filler is. And it's crucial to know in which layer was applied in order to decide if you want to treat this patient or not. And of course, we need more complementary studies to answer some more questions about this. Now, with ChatGPT, probably describes better who we are because they summarize everything regarding us. I have a little Maltese. You can see it here. I love the facial surgery. Nowadays, it's the only thing that I do. But I don't want to miss the opportunity because I'm going to be a host in Mexico in October in Cancun. It's an amazing place. And it's an honor for our country to hold an international meeting like ISAPS. And of course, the Aesthetic Society is going to be there because you are one of the most important global partners. So thank you so much for your kind invitation. And please, I'm waiting for the Q&A feature, and thank you so much.
Oh, very good. Thank you. Thank you. Excellent presentation. And again, she mentions the ISAPS meeting. I'll be there. The ASJ team will be there. Dr. Kenkel, Mark Tice, all of us. So we do encourage you to come, and also to our meeting happening in May next month in Boston. I'll put a link in the chat. So we absolutely, and we're getting some nice praise here. Thank you. Excellent presentation. Go ahead and put your questions in the chat box. I will kick it off with a poll so we can start here. And in hindsight, I believe you've already answered this question, so we'll see how nicely everyone was paying attention here. And while that poll is up, Doctor, I will ask one of my own questions to get us started. So how would you approach cases where the filler type is unknown or undocumented?
Well, unfortunately, Fidriam, all of the fillers, we don't know what kind of filler was applied. And not all the patients have the stickers, so the filler was used. And we have to ask about the evolution of the fillers, how many times they were applied, but most of them must be probably hyaluronic acid. At least in the tip of the nose, this is the filler that is more common used. But if the filler was in the union of the nose and the forehead, probably it's a permanent filler. And we cannot do nothing in that way. We cannot try to go and remove it there. It's very complicated. Mm-hmm. Probably the only filler that we can approach is the fillers that were applied in the tip of the nose.
Understood. Let's see here. We'll get our first results of the poll here. So I had asked, how often do you encounter patients seeking rhinoplasty after prior nasal filler injections? And it looks like 46% are saying rarely, less than one a month, and 23% they're saying frequently. So that's that. Let's move on to our next question. What clinical signs make you confident that it's safe to proceed without prior dissolution of the filler? So what are you looking for to make sure that it's okay to proceed?
Well, first of all, is to try to make complementary studies in order to see if the filler was applied in the proper layer. Probably this is the clue to accept or reject a patient. I don't know in USA, but probably in Mexico we have problems with personnel who apply fillers and they are not physicians, and they don't know where to put the fillers. And if they inject the fillers in the very superficial layers, we are going to have a problem with an open rhinoplasty. So if the filler was injected by another physician, it's better to say no because we don't have a clue what is going to happen with this patient. But if we have the certainty that the filler was applied by a very professional dermatologist, plastic surgeons in the proper layer, and we have the complementary studies, CT scan, and we can see exactly where's the filler, probably we have the chance to offer an opportunity to these patients.
So what is that conversation like if you reject a patient or you tell them, I'm sorry, because of this pre-existing situation with fillers that I can't take your case? How does that go, and what's been your experience with those conversations?
Well, you have to be very honest. It's not only a matter of the nose. We can see the same in the face, for example, with a multi treatment in patients who have fillers, threads, energy, etc. You have to be very honest. I don't have enough the skills. At least is the way that I approach this. I studied your case. It's a difficult case. You can have more complications than benefits. And unfortunately, I wouldn't dare to do something that make worse the result or have any risk. Sometimes the patients are going to ask you, I take the risk. But you have to say, well, you take the risk, but I don't take the risk. So it's very important. And my most important recommendation is to keep it that way, to wait longer, or to consult another physician. But it's a mistake to try to say yes if you don't have the experience, if you don't feel comfortable, if you can have a problem.
Yeah, exactly. And on the flip side here, are there any cases where you would immediately do the surgery without waiting or dissolving the fillers? Any kind of, whether it would be more of an emergency, or are there any cases where it's less of an issue and you would just immediately do the surgery before dissolution of the fillers?
Well, the only emergency is when you have a vascular problem with the rhinomodeling, with a block of the vessels, and you can have, in that moment, problems with the vascularity of the nose. The problem is more regarding the filler application. But in case that the patient is seeking for a rhinoplasty after the rhinomodeling, it's very, very important to take the opportunity to wait at least 1 year after the rhinomodeling. Don't rush. Keep your patient and say, wait, you did this nose job with fillers, you have to wait. Is the best recommendation. It's safe for you, even legally, because if you rush and you have any problem, you cannot support why you do it so fast. And the only thing that probably will be controversial is if you dare to try to solve the filler before surgery or not, because there is not any specific recommendation in this field. There are groups that do it, there are groups that don't do it, and there are another surgeons that say it doesn't matter you have the filler or not, only wait 1 year and you can go there. My recommendation is, if the skin of the patient is thick, probably you can use hyaluronidase, because even if the skin is thinner with the hyaluronidase, you're not going to have so much problem. But if you have a very thin skin and you apply hyaluronidase and then you try to do an open approach, it's probably that you will have a problem. Mm-hmm. So we must be very careful about this.
And interestingly, we've got a group that agreed. The results of the last poll were asking how long would you wait until performing rhino after fillers, and it was 36%, the majority saying at least a year, and then another 36 saying case by case. So I think they're in agreement with you there. Now, moving on to the kind of more of the surgical techniques and inter-op considerations. So what intraoperative findings most commonly differ in your post-filler noses compared to primary rhinoplasty?
Well, the main difference is that the swelling process that you have, when you apply fillers, the fillers look good at the beginning because increase the projection and something. But at the end, it's going to produce a swelling. And this swelling can be worse in some patients because it's not the same in all the cases. But you can find, and you can see when you open a nose, where is the filler, because as you saw it in the pictures, it's going to be a very thick substances, very adherent, especially in the bottom of the nose, in the cartilage. And you can identify the difference between cartilage and the filler. And sometimes if you grab it, you can see it like that, like a gel. And so you can remove it, to take it very carefully and remove it. It's very important to wash in order to prevent the biofilm. But the main difference is in the SMES layer. because in the bottom you are going to find a very normal cartilage. So that's why it's very important to understand that the main safety procedure is try to avoid the very extensive dissection. You have to, even if you want to see it better, it's not recommended to make an extensive dissection for the problem of the vascularization that you can have. So try to do it with a more carefully approaches, but you can remove it when there is very attached with the cartilage structures. You are not going to have problems there.
Okay, very good. And have you modified your dissection plane or your technique for these particular patients?
Yeah, I changed everything. After this patient, of course, I understand that the years of practice is not it's not safe if you don't pay attention when you have a problem and you try to figure out what happened and what kind of things you can change. And of course, first of all, I ask intentionally all the patients if they have a nausea with fillers before surgery, because it's a question that sometimes we ignore. We pass it away, never ask. And sometimes when you're there, you say, oh, you have fillers here. And that will be a very interesting question as well. How many of you find fillers and they never imagine that will be there? And the second is, if the patients say yes, at least in Mexico, it's not expensive to do a CT scan. In the Rhinoplasty Society with Dr. Rorick, he mentioned that at least in the United States, it's very expensive to ask for a routinary CT scans before rhinoplasty in all the cases. But I try to do it here. It's not expensive, but I have a clue, even in the patients, if they don't know or they forget to have the filler, and then the filler is permanent, it's going to be there. So I try to complement my pre-op diagnosis with a CT scan. And then, depending if the filler is in the proper layer, I say yes. But if the filler is not, I prefer to say not. And as I mentioned, I'm going to remove the filler. It has to be in an open approach and try to avoid a very excessive dissection, not to use very projected grafts and everything that I mentioned before.
So as you mentioned, you'll only do open rhinoplasty on filler patients.
No, I used to do a structural open rhinoplasty most of the time. I like that approach. I have my control. I know that many skilled plastic surgeons prefer the closed approach, but at least in my hands, I have more control. And I cannot imagine how to remove a filler if you do it in a closed approach. I don't know if somebody has experience doing this with a closed approach, but I can imagine it will be difficult sometimes.
Sure, of course. I want to remind the audience here that we are happy to take your questions if you have any for Dr. Torres. And let's see, moving on here, let's talk a little bit about risk management and complications. So do you feel, other than this one patient where you said you learned a lot from him, that there's a higher rate of complications in general in this patient profile post-rhinoplasty, so post-filler, so skin necrosis, infection, wound issues?
I think that probably the only more potential risks are regarding to the infections. Nowadays, if we know more about this, and if we are more careful, we must stay in a safety zone. And we are going to have to fence this in the future with more often circumstances like this, because many patients in the past do it, or they are going to look for a rhinoplasty. But only to have in mind that you must be more aware about infections due to the biofilm. Probably the surgery will be perfect, everything, but you can have an infection. And you have to be very close to this patient, because if you have a minimal infection with an increased risk of vascularity problems, you can have a disaster. So it's the only thing, to be more close with this kind of patients and to try to use antibiotics for longer periods of times, and that's it, I think.
So is the antibiotic prescription the only major difference between a non-filler rhinoplasty, or are there any other protocols that you use on the
Yeah,
patient profile?
when you do a primary rhinoplasty, really you don't use antibiotic prophylaxis for many days. You only apply probably intraop, and that's it. But in these patients, they need it. They need it for to try to avoid any possibility to infection.
Yeah, that makes sense. And we talked a little bit about how you would reject a patient, but how are you, what's the conversation like on the front end when they come in, they identify that they've had fillers? Are you counseling them about risks and potential complications? Are you discouraging them in some cases? You know, maybe some people are what we call a frequent flyer and maybe the issue isn't so bad. And what does that conversation look like?
Well, first of all, we have to listen because if the patient is looking for a perfect result, we must be aware of course, because it's not a normal nose, it's not a normal tissue, and he must be aware that it's not only the problem that we can have in the process during or after the surgery, it's about all the result that they are waiting for. And many patients inject the nose with fillers because they like the result. But what happened is that the result lasts for a few years and then disappear, and they do it again. But the second, third, or more applications that they have, the nose start to losing the shaping that they used to have, because as everybody knows, the fillers catch water, increase the swelling process, and sometimes produce deformities. And they are going to have this, and that's the moment where the patient is looking for the rhinoplasty. But
Right.
unfortunately, sometimes these swelling process are going to continue even after the surgery of the rhinoplasty or removing the fillers. These patients has more chances to have an intermittent and chronic inflammatory process, especially when they are going to the beach, they are going to do exercise or something. They have more possibilities to have inflammatory process and less definition in the nose as well.
Understood. So in our final moments here, I just want to give you the opportunity to give any closing thoughts. And of course, we're very grateful for your time and expertise, but any final thoughts that you'd like to share?
Well, of course, feel free to contact me if you have doubts about this. It's very important to, we're planning to do a study with experts. As the Aesthetic Society, ISAPS, and all the societies, the Mexican societies, are very, very aware about safety. And the best way to try to figure out and answer so many questions that are still in the floor is to join experts and have a consensus, not only national, international, with people from all the world to try to figure out what are the advices or the things that they believe are the better, at least to try to have a path to follow. In the meantime, that the literature or the evidence change. Probably the most important message is for the younger patient, the younger surgeons, because they are very, I don't know how to say, but probably they don't imagine that they can have a problem. And they do dare to do these kind of procedures as the first patients that they have, and they have to follow a very long trip before to dare to treat these kind of patients. And for the older ones like us, is that not have an excess of trust, because could be not only a nightmare to try to fix a patient with a problem like this, but your practice, your prestige could be in danger if you don't pay attention in these kind of things. So this field, nose, face, must be very careful when the patients do aesthetic procedures before, and we must have more data about this. Probably must be more careful and follow the things that we already have is the best recommendation that I can provide.
Well, wise advice, excellent presentation. Thank you for being with us. And many of us will see you in either Boston or Mexico. And I know I'll be seeing you around the world. And thank you for sharing your insights with us and being with us on ASJ GEMS today. We appreciate you.